Currently, WHO is aware that 13 cases of Ebola have been confirmed by INRB in Kinshasa, and on the 5th of May, WHO received a signal of suspected cases and sent a team to Ituri to support DRC health officials in their investigation of the outbreak and collect samples in the field, which initially tested negative for Ebola.
The Aedes species is still the most fatal, and I will tell you, the fatality in terms of lethality, or what we call virulence, we've learned many things is a factor of care. Because in the past we would run away from Ebola patients.
The timeline of this new epidemic goes back to the start of this month, when a first alert through social media came on the 5th of May. Our teams were deployed and mobilized immediately and confirmed a documented alert on the 8th of May.
Documenté le 8.
Hospitalisé, donc la situation est catastrophique.
Kirkhoff, Interim Director of WHO's Department of Epidemic and Pandemic Management. We have a couple of other colleagues.
The Ebola outbreak in the Democratic Republic of the Congo is spreading rapidly. Previously, WHO assessed the risk as high at the national and regional levels and low at global levels. We're now revising our risk assessment to very high at the national level, high at the regional level, and low at global level.
So we cannot run several responses, and conflicts prevent us from having a global response. So yes, there is an impact, And the impact is significant, especially since we must not forget that in this area there are also displaced people. And these displaced people are also a consequence of the conflicts, and this makes things even more complicated.
Something else that I know is concerning people that's on the news is Ebola. Our number one obligation, we're involved in foreign policy, but even our foreign policy, the number one priority of our foreign policy is to protect the American people. We cannot and will not allow any cases of Ebola to enter the United States.
People are dying. How can we come and say we commit X million dollars and the next day they are calling me to say no, it was a mistake?
I want to introduce you to the team that's been working very hard.
So people can recover. Of course, we're working on vaccines and treatments, but that doesn't mean that people cannot recover from Ebola.